Hello, and welcome to the APhA-ASP Women's Health Campaign Outstanding Chapter presentations. I will now turn it over to the chapter leaders at the University of South Florida Tunisia College of Pharmacy.
Hi, my name is Jenna Ferreira, and my colleague Eric Chung and I served as the co-chairs for Operation Women's Health at the University of South Florida Tunisia College of Pharmacy. Before we begin, we would like to take a moment to thank Merck for sponsoring and funding APhA-ASP Operation Women's Health and making these projects possible. Also, in an effort to accommodate COVID-19 social distancing guidance, this presentation is being recorded remotely with both presenters at different locations. To streamline this somewhat awkward process as much as possible, Eric will be controlling the slide deck and progression. Despite the odd circumstances of the situation, we are very excited to present this information even in a remote setting. I, Jenna, will be starting us off. This presentation is designed to showcase the process in which our operation came to be, some of the events we executed, and most importantly, why we chose to pursue these events, and the topics of women's health in which they represent. I find one of the most unique aspects of our operation is the fact that Eric and I created a women's health initiative prior to national APhA adoption. Essentially, we both expressed similar concerns with one another over the lack of education and resources surrounding women's health in various aspects of both our professional and personal lives. And this discussion took place initially in very casual settings, texting and chatting about our frustrations. However, one day we decided to literally just sit down in my favorite local coffee shop, which is called Felicitas, and came up with a physical game plan. We performed a needs assessment. We sat in that shop till literally almost close, just pouring all of our ideas, concerns, and frustrations into this singular Word doc. This provided us the chance to really discuss in depth our individual and shared experiences. For example, Eric is Chinese and a member of the LGBT community. He's bilingual and was able to provide the perspective of his family, and his communities. I volunteer with individuals affected by HIV and AIDS, and individuals struggling with housing. I was able to bring that perspective in addition to my own lived experience as a woman. We then looked past our own lives, took a public health approach, and analyzed the needs of the local Tampa Bay patient population and then Florida as a whole. So by this point, we knew the issues we wanted to address, but more importantly, we knew we wanted to create events and initiatives that would produce truly meaningful impact. I am not what I would refer to as a CV stuffer. I don't participate in student orgs and such things for the sake of having the ability to simply say, yeah, I did that. Here it is on my CV. I and Eric both wanted to create an operation that would have long-term sustainable effects that would best prepare student pharmacists to care for all members of the community. And that brings us to the concept of intersectionality. So what is intersectionality, and why is it important to utilize an intersectional approach to providing patient care? Intersectionality, a term coined in 1989 by Kimberly Crenshaw, essentially describes the intersection of various components of an individual's identity and how they create a unique experience. Examples of such components include race, gender, age, country of origin, sexual orientation, disability, socioeconomic status, and more. For example, a queer, disabled, poor Black woman lives a much different experience than that of an able-bodied, wealthy white man. Each of these mentioned aspects carry with them different forms of both discrimination and privilege. And none of these components of identity exist in a vacuum, correct? Rather, they compound upon each other, intersecting, if you will, to create the lived experience of the individual. In my personal and professional life, I try to view my interactions, especially with patients, through an intersectional lens. And in all honesty, none of us in healthcare can provide proper patient care without recognizing, honoring, and truly attempting to understand what it would be like to place ourselves in our patient's shoes. After performing our needs assessments and diving into operation planning, Eric and I both agreed to create events and initiatives that would educate student pharmacists on how to provide effective patient care through an intersectional lens. And with that being said, we will now transition to Eric.
Thanks, Jenna. Again, my name is Eric, and I will be transitioning us to the next part of our workshop. To begin, I would like for us to reflect on these two questions. Now is a great time for you guys to pause the video and to reflect on these questions with your team. When Jenna and I started planning our women's health campaign, we utilized these questions to help us get to know our community better. From the responses of these questions, we were able to focus on specific areas of needs within our community and what we as student pharmacists, future pharmacists, and healthcare providers can do to address these needs within our community. Establishing intersectionality as our foundation, we were able to identify how unique our community is in the Tampa Bay area. Our research indicated a high population of bilingual residents. These residents are composed of immigrants who may not be fluent in English or are first or second generation of immigrant families from another country. These are English speakers of other languages or ESOL patients who are navigating through a healthcare system they are unfamiliar with because of how different the healthcare system is structured here in the United States. These are the barriers to their access of care and to their health literacy. The ESOL patients within our community in the Tampa Bay area consist of majority Spanish speakers. By identifying our target patient profile, this allowed us to see an opportunity to work with another USF student organization known as the Hispanic Association of Pharmacists, or as I will be referring to them as HAP. By collaborating with HAP, we were able to organize a unique and impactful event for our chapter members that showcase the importance of assessing the health literacy rate of an ESOL patient. This resulted in an event known as the Health Literacy Race. Participants were given an authentic experience in working with a translator to counsel their patient on a women's health over-the-counter product. This challenge tested communication skills between the translator, standardized patient, and the participant. By establishing their patient's health literacy rate, the participants were then able to make an impactful intervention. This event has empowered our members by providing them with the confidence and skills they can carry with them into their rotations and further into their careers as practitioners in the field of pharmacy. Now, switching gears into another pillar of our women's health campaign, I would like for us to reflect on this question. Now is also a great time for you to pause the video and to think about this question with your team. As Jenna and I got to know the needs of our community, we realized how fortunate we are to live in a metropolitan area that provided several resources to hormonal contraception and emergency contraception. We also recognize that there are many communities in our nation that lack these resources and lack the accessibility to attain these resources. Prior to the national adoption of Operation Women's Health and APhA, we had hosted an event on our health campus with our local Planned Parenthood in order to address the stigmas surrounding abortions. During this event, we identified a gap of knowledge on an interprofessional level. Hormonal contraception, family planning, and accessibility to these services within our community are not properly represented. In addition to the lack of representation, there are many threats aiming to remove these resources and services that our patients depend on and trust. Our passion is to invoke more advocacy from all providers in order to protect our patients' rights to healthcare. We identified that there are a lack of awareness, which ultimately results in the growing stigmas and misconceptions surrounding hormonal contraception. We wanted to approach this gap in knowledge by providing an interprofessional education component that will showcase the evidence-based practice of hormonal contraceptives and how it continues to evolve with our society. Our goal is to start the conversation of why we, as an interprofessional healthcare team, need to educate ourselves in order to serve our patients to the best of our abilities. As a result of our research, we were able to organize the Birth Control Professional Development Unit, or Birth Control PDU. We have invited Dr. J.K. Williams, an OBGYN from the USF Student Health Services, and a clinical faculty member of the USF Morsani College of Medicine to come to our health campus as our presenter. Dr. Williams led an open discussion that put into perspective the history of hormonal contraceptives and the misconceptions of risk factors that surrounded them. He challenged our minds and also the field of pharmacy as the legislature on oral hormonal contraceptives are moving from prescription to over-the-counter. This is one of the many steps within women's health that will move pharmacy forward. Now I will be handing it back to Jenna to speak about our last event and to conclude our workshop.
During my employment in the community pharmacy setting, I worked with a technician who believed emergency contraception, Plan B specifically, caused abortion. She viewed this medication to have the ability to literally terminate pregnancy and refuse to sell the product. As professionals, we know the mechanism of that drug, and for this simply to not be true. However, that moment really stuck with me because I saw in real life the implications of misinformation surrounding women's health and the direct effect it had on patients. This sparked the creation of the OTC Challenge. The OTC Challenge is one of my personally favorite events, as it is one of the most engaging events that allows you to see essentially instant results amongst participants. The OTC Challenge is an interactive event where participants select a photo of a woman's health product at random and are then instructed to counsel a partner on the item using only existing knowledge. In times where American healthcare is becoming increasingly inaccessible, community pharmacists are not only the most readily available healthcare provider to patients, but sometimes the only one available. Considering this, community pharmacists receive a wide variety of counseling questions, and we wish to highlight this experience while bringing awareness to existing gaps in knowledge surrounding women's health products. Examples of products counseled on include tampons, pads, Diva cups, feminine douches, period symptom relief tablets, yeast infection relief products, and more. This event put participants in sometimes an awkward situation, but allowed space for very real and very productive conversation to occur. For example, a colleague of mine shared a personal story regarding the distress he experienced shopping for tampons with his 13-year-old daughter for the first time. And he also later explained how this event made him feel much more confident in his knowledge on the use of these products. Other topics discussed include varieties from cultural health beliefs in regards to the use of douches, for example, and even the spectrum of gender identity, and how sometimes male identifying and presenting patients may require the use of some of these products. And at the end of the day, the main goal of this operation is to help foster the growth of student pharmacists in a manner that allows them to serve all patient populations. And this event definitely achieved that goal. Again, this is simply a snapshot of our operation. In addition to the events discussed here, Operation Women's Health members also participated in other events in volunteerism and advocacy. If you or any member of your chapter have any additional questions or suggestions, please do not hesitate to contact myself or Eric at the email addresses listed below. Also, if you have any questions about APhA Women Health Campaign initiative in general, please visit the APH website listed below. Again, thank you to APhA for giving us this platform to share our operation with you, and to Merck for seeing the importance of women's health and being an official sponsor for APhA Operations Women's Health.
This concludes the presentation. Thank you very much for joining us.